So for people that can't wear their CPAP, they have sleep apnea, they've been diagnosed with sleep apnea, but they can't wear it. You said 60% of the time that they just put it in their closet or in their drawer, they don't use it. But there's a treatment, I guess. And what is it?
That also has to do with the way how your teeth come together.
Okay.
And we create appliances for these people that allow the muscles of the neck to be open and to have more air to come inside. You know, to have a machine to shoot air through your nose, the whole night, is something that some people find it very uncomfortable. Now, you place this appliance in your mouth, you can sleep through the night, and you wake up with more energy in the morning. That's the simple way how I can describe it.
So these are people that breathe fine all day long. They're walking around, they breathe. But when they lay down at night, I guess their tongue
goes
back.
back.
So you just move it forward with an appliance.
Yes, the jaw goes back and the tongue goes back with it. And then as well, the muscles collapse in there, and then your airway cannot function the same way how it's supposed to. And you get very cranky in the morning when you have to wake up, or you spend the whole night snoring, and either your spouse cannot tolerate it or your kids. You know, I have a young lady that she came to us and she said, you know, my husband really hates to sleep with me. We had to get separate rooms.
Because of the snoring?
Because she was snoring. I mean, most of the time are men who snore, but she was the one who was snoring so bad that he couldn't have a full night's sleep. And then she said, you know, after you gave me the appliance, not just he was able to sleep and I was able to sleep with him, I had my relationship back. I also felt more energetic. I was feeling very sick, very low energy. I thought I had to take more vitamins, but I just didn't know that I wasn't having a long night's sleep.
So you give them a sleep test that they could take at home?
Yes.
To tell them how much they're sleeping?
Yes, that sleep test is a basic sleep test. It's read by a physician, by MD, and he will tell us how severe that sleep apnea is. And depending how severe that sleep apnea is, you may have to go to the hospital to continue those studies, or we can do right in there an appliance that will improve your symptoms. But the reality is that a lot of patients who wear CPAP, they are not comfortable with, because they feel that they cannot fall asleep.
So this discussion is for people that can't wear or refuse to wear the CPAP?
Or with people that have CPAP and wanted to try something else that may benefit them. And we have seen a lot of patients.
So do you have a lot of people that were on CPAP and now they're off with one of these devices that you make for them?
They feel more comfortable with the devices. We don't recommend them to come out from the CPAP, at least that the doctor had.
But if they refuse to wear it, this is an option.
Yeah, if they refuse to wear, that's an option. They have to have an option. They have to have another way how to breathe. You cannot just go to sleep and fall asleep during your job. Let's see if you are a conductor, a train conductor. In New York, a couple of years ago, around my house, a train conductor fell asleep, crashed the whole train coming down from Westchester. There were a lot of people that were dead just because that person, and later on it was confirmed that he was suffering from sleep apnea. Now, there are more and more drivers' accidents that happen because.
So this is a big part of your practice? Treating sleep apnea?
Yeah, that's a big part of our practice, treating sleep apnea. We see a lot of people that they need to have the sleep apnea addressed because that is interfering not just with their life, if not with other people's life.